Every year, millions of seniors go in for routine checkups, believing they are doing the right thing. But what if I told you that some of these very tests might actually increase your risk of a stroke overnight? It sounds hard to believe, doesn't it? You trust your doctor and follow every recommendation. However, buried in the fine print of modern medicine are silent risks that no one warns you about. Not the news, not the brochures in your clinic, and sometimes not even your doctor. Imagine walking out of your annual checkup thinking everything is fine, only to experience dizziness, blurred vision, or even worse just days later. You may be left wondering, what just happened? Here's the truth. Certain diagnostic tests, especially when done too frequently or under certain health conditions, may quietly trigger sudden spikes in blood pressure, disrupt blood flow, and set off a chain reaction that can lead to a stroke. But don't worry, this message isn't meant to scare you. It's here to inform you, so you can ask better questions and protect yourself and your loved ones. After the age of 60, it's not just about catching problems early. It's also about avoiding the ones we might accidentally cause. In the next few minutes, we'll uncover the 5 most common medical tests that may carry hidden stroke risks, especially for seniors. More importantly, you'll learn how to protect yourself before your next appointment. Now, if you've ever had a CT scan with contrast, you might remember that warm, flushed feeling spreading through your body. That's the contrast dye doing its job, helping your doctor see your blood vessels, organs, and tissues more clearly. Sounds helpful, right? But here's what many seniors are never told. That injection can do much more than enhance the images. It can quietly put stress on your cardiovascular system, especially if you're over 60 and are already dealing with high blood pressure, heart problems, or kidney issues. For some people, the contrast dye triggers a vasovagal reaction, a sudden drop in both heart rate and blood pressure. This can lead to dizziness, nausea, fainting, or even brief unconsciousness. In other cases, the opposite happens. Blood pressure spikes rapidly, causing fragile blood vessels to tighten or spasm. When that occurs, the risk of a stroke or a cardiac event quietly creeps in. A study published in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension, cardiovascular disease, or impaired kidney function. In short, the more vulnerable your system, the more dangerous that contrast dye can become. Let me share a real case. An 81-year-old man went in for a routine abdominal CT scan due to minor digestive discomfort. The scan came back normal, and he was sent home feeling fine. But 2 days later, he suffered a minor stroke. The likely cause? The contrast injection may have temporarily spiked his blood pressure, which could have led to a clot forming and blocking blood flow to part of his brain. This doesn't mean CT scans with contrast are bad. Far from it. They can detect cancers, blood clots, and aneurysms, issues that could save your life. The key point is that these scans should be used wisely, not just ordered as part of a routine checkup, just in case. What can you do? Before agreeing to a CT scan with contrast, ask your doctor, is this scan essential? Is there a safer option for someone my age and condition? Be sure to share your full medical history, especially if you have high blood pressure, kidney disease, heart conditions, or previous reactions to contrast dye or medications. Always ask, can we do this without contrast? Sometimes a non-contrast CT or an ultrasound can provide enough detail without the added risk. Coming up next, we'll discuss a common screening that many seniors receive even when they feel perfectly fine, which may not be as harmless as it seems. Let's discuss the stress test, commonly known as the exercise stress test. On paper, it seems like a smart approach. Wear a heart monitor, walk on a treadmill, and assess your heart's performance under pressure. However, if you're over 60, particularly if you have high blood pressure or existing heart conditions, This seemingly simple test can be risky. Here's why. During the test, you will be asked to walk or jog on a treadmill while your heart is closely monitored. As the speed increases, your heart rate climbs, blood pressure rises, and your cardiovascular system faces intense strain. For a healthy 30-year-old, this might pose no issues. However, for seniors, especially those with pre-existing conditions, it can be comparable to igniting a fire near dry brush, potentially leading to severe complications. Some of the risks include dangerous spikes in blood pressure, sudden arrhythmias, irregular heartbeats, and, in rare cases, small tears in fragile blood vessels, particularly in the brain. A 2020 study published in the American Journal of Cardiology examined over 1,300 patients aged 65 and older who underwent treadmill stress tests. The results indicated that nearly 7% experienced adverse events during the test, including blood pressure surges and abnormal heart rhythms. The most affected group was those with existing vascular issues. This isn't merely theoretical, it reflects real-life experiences. For instance, one of our subscribers, Margaret from Ohio, shared her story. At 74, with a history of high blood pressure, her doctor recommended a stress test for monitoring. Halfway through the treadmill portion, she started feeling dizzy and experienced tightness in her chest. The test was stopped immediately, but the following day, she suffered a minor stroke. Doctors suspect that a sudden increase in her blood pressure during the test led to the rupture of a tiny vessel in her brain. To clarify, the test did not directly cause the stroke, but it did introduce stress to an already vulnerable system, tipping the scale. What should you do? Consult your doctor and ask, is there a safer way to evaluate my heart? In many cases, alternatives such as a nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram may be safer options for seniors. If you are not currently experiencing symptoms like chest pain, shortness of breath, or fatigue, question whether the test is truly necessary at this time or if it can be postponed. Now, let's address another common procedure for people over 60. The endoscopy. Whether to examine your esophagus, stomach, or colon, doctors often recommend it for precautionary reasons. While this can sometimes be warranted, there are important caveats. What many people don't realize is that if you don't genuinely need the procedure, especially if it involves sedation, it could do more harm than good. Most individuals over 60 take some form of medication, such as blood thinners like warfarin, aspirin, or Plavix. When sedated for an endoscopy, blood pressure and circulation can change naturally. Combined with medications affecting blood clotting, this increases the risk of internal bleeding or even brain circulation problems, which might lead to a silent stroke. A 2021 comprehensive review published in the Journal of Gastrointestinal Endoscopy found that patients over 65 who underwent sedated endoscopy procedures experienced a significant rise in transient ischemic attacks, TIAs, also known as mini-strokes, within the following 72 hours. While these were not full-blown strokes, they indicated that something had gone amiss with blood flow to the brain. One particular case I remember involved a 76-year-old woman who underwent a routine colonoscopy with sedation. She had no symptoms prior to the procedure, but 2 days later, she began slurring her speech and lost coordination. The ER confirmed she had suffered a mild stroke. Doctors believe that the drop in blood pressure during sedation, combined with her daily aspirin use, may have created the perfect conditions for a clot to travel. Even if the procedure itself is deemed low risk, the combination of sedation, age, and medications can create a precarious situation. What should you do? This doesn't mean you should avoid all endoscopies. However, don't agree to one unless your doctor can clearly justify its immediate necessity. If you're only getting one because it's been a few years, ask whether there are safer alternatives for monitoring your condition, especially if you have no symptoms. Always inform your doctor about your medications and inquire. Will I need to stop my blood thinner before this? And what are the risks of sedation for someone like me? If you're hesitant about sedation, ask if the procedure can be performed without it or with lighter options. Next, we're going to discuss a test that often goes unnoticed, but it relates to something many of us rarely consider: the kidneys. MRIs are powerful tools that help doctors examine the body, identify early signs of trouble, and often avoid unnecessary surgeries. However, when a contrast dye is added, typically to enhance image clarity, caution is essential, particularly for older adults and those with even mild kidney issues. The contrast dye commonly used in MRIs contains gadolinium, a heavy metal designed to be eliminated by your kidneys. However, there's a catch. Kidney function naturally declines after age 60. If you already have chronic kidney disease or undiagnosed reduced kidney function, your body may not effectively flush out gadolinium.
Over time, small amounts of gadolinium can remain in the body, which can be dangerous. Retained gadolinium has been linked to a rare but serious condition called nephrogenic systemic fibrosis, NSF, leading to hardening and thickening of the skin and connective tissues. In severe cases, it can restrict movement, impede breathing, and cause organ complications. Moreover, retained gadolinium has been found in brain tissue. Some researchers suggest it may lead to subtle neurological symptoms like confusion, dizziness, and disorientation, especially in individuals already at risk for circulatory issues. A study published in Radiology in 2019 followed over 2,000 patients over the age of 65 who received contrast-enhanced MRIs. Within a week of the procedure, approximately 5% reported symptoms resembling those of a stroke, such as headaches, blurred vision, and balance problems. While these were not full-blown strokes, they were concerning red flags, particularly since most patients had underlying kidney problems, whether diagnosed or not. Consider the case of Harold, a 79-year-old veteran from Arizona, who underwent an MRI due to persistent back pain. His doctor ordered a contrast-enhanced scan to be thorough, but Harold was unaware of his weakened kidneys. 2 days after the MRI, he felt lightheaded, weak, and mentally foggy, symptoms that persisted for nearly a week. It wasn't until his primary care doctor ran tests that they discovered he had stage 3 kidney disease. "No one warned me," he said. "Had I known, I would have asked more questions." What can you do? If your doctor recommends a contrast MRI, consider asking, "Can we do this without contrast?" The answer is often yes. If contrast is deemed necessary, request a kidney function test first. This simple blood test, known as a GFR glomerular filtration rate, can provide valuable information for both you and your doctor. Also, inform your healthcare provider if you've experienced any unusual reactions to imaging tests in the past. Remember, the MRI itself isn't the issue. It's the added chemical that your body may not be able to handle effectively. By taking the right precautions, you can still receive the needed answers without jeopardizing your brain or kidney health. Now, let's shift our focus to a test that might seem harmless and even prudent to undergo regularly: the routine carotid artery ultrasound. This non-invasive test takes just a few minutes and doesn't involve needles, dyes, or loud machines. It sounds like the ideal preventive measure, right? However, many people over 60 are unaware that if they have no symptoms and their doctor orders this scan just to check, this seemingly simple test might lead to unnecessary surgeries. The carotid arteries are the primary blood vessels. This process is normal, especially as we age, but not every bit of plaque needs to be surgically removed. In fact, in many cases, monitoring the plaque is safer than opting for surgery. Here's where things can go wrong. Let's say you have a test that shows some narrowing in your artery, maybe 50% or even 60%. That sounds alarming, right? So your doctor refers you to a vascular surgeon, and suddenly you're being told to consider procedures like a carotid endarterectomy or a stent. However, if you have no symptoms, no dizziness, no vision changes, no weakness, these procedures may provide little benefit and carry real risks. In fact, a significant study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing, but no symptoms. The researchers found that in many instances, surgery did not significantly reduce the risk of stroke compared to medication and lifestyle changes. More troubling still, a small percentage of those who underwent surgery actually experienced strokes as a direct result of the procedure, either during the surgery or in recovery. One story that highlights this issue comes from Helen, an 82-year-old from Pennsylvania. She went in for a routine checkup, felt perfectly fine, and had a carotid ultrasound because her doctor wanted to be thorough. The scan showed 65% narrowing, and she was referred for surgery within weeks. Tragically, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She later expressed, "I wish I'd known that doing nothing might have been safer." So, what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, "What are we looking for? What happens if we find something?" Make sure you understand whether the scan will change your treatment or simply cause unnecessary worry. If you're already taking blood pressure medications, cholesterol drugs, and leading a healthy lifestyle, extra tests may not make much difference. If you've had a scan that indicated some narrowing, don't panic. Consider asking about repeat scans instead of jumping straight to surgery. Always seek a second opinion before undergoing any vascular procedure. Let's wrap this up with some friendly advice and a gentle reminder that your health is in your hands. Here's the bottom line. Not every test is dangerous, but not every test is necessary, especially after 60. Our bodies respond differently as we age. What seems routine, like a contrast dye, a sedative, or a scan, can have unexpected consequences.
For example, a simple injection might spike your blood pressure. A scan might trigger a reaction, and even a quick checkup can carry risks if your system is already vulnerable. That's why it's crucial to pause, ask questions, and ensure every test aligns with your health needs, not just follow a checklist or protocol. You have every right to speak up, to ask, "Is this really essential?" and to say, "Can we explore a safer alternative?" Informed decisions lead to better outcomes and peace of mind. Your health story matters. Your voice matters. At 60+, we believe every choice should be guided by knowledge, not fear or habit. Let's connect. If you've ever felt strange after a scan or test, or watched a loved one go through something unexpected, drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. If this video helped you feel more informed, more in control, or just more curious, consider subscribing to 60+. We're here to uncover the truth, ask the hard questions, and always prioritize your well-being. Thank you for watching, and remember to stay informed and empowered.